Good morning, Peter Goertz. I'm a psychiatrist. Can emotional trauma cause physical problems? In my experience, there seems to be a strong connection between emotional trauma and physical problems. And maybe the distinction even is artificial between emotional and physical. Maybe they're always two sides of the same coin. And the brain, the heart, and the gut may well be connected with emotions. So the old sayings, I feel it in my heart, or I have a gut feeling, may have a lot of wisdom to them. What caused me to talk about this is a patient I recently saw, and again, patients have pushed this issue in my face, that emotions are related to physical issues, and that includes trauma, of course, and the trauma could be from childhood abuse, sexual, physical, could be from combat. And the emotional and physical are pretty obviously related, I think, to anybody. You know, if you get upset, you might lose your appetite. If you're anxious, your heart rate may increase. So that pretty much shows us the general issue that there's a pretty clear connection between emotions and physical functioning. And there can be intermediate issues. For example, if someone has emotional stress, they may overeat, and that can cause physical problems. They may use drugs and alcohol, which can also cause physical problems. They may smoke. And different examples over the years have been prominent in showing me that connection. For example, when I was an intern, a patient was scheduled for a routine surgery, I think hernia surgery, and she kept on saying, I'm gonna die, I'm gonna die. And we were wondering, what is going on? This is a routine surgery. And sure enough, the lady died shortly after the surgery. I don't remember the exact issues causing the death, but that was quite shocking and also thought-provoking. Another issue I ran into as an intern was quite a few patients in the GYN clinic would come in with pelvic pain. And I, at the time, never thought to ask them, is there a history of sexual or physical abuse? Because in hindsight, I'm wondering if maybe at least quite a few of those ladies may have been having pelvic pain, possibly related to trauma or emotional issues, and maybe even some of them underwent surgery because of the complaints of pelvic pain. Maybe even they had a hysterectomy, but the pelvic pain may have been at least in part related to, in hindsight, I'm thinking, emotional issues. Another aspect is neurochemicals, so neurotransmitters like serotonin, norepinephrine. Serotonin plays a role in the brain, but also in the body, in the gut, for example. And norepinephrine plays a role in the brain and the body. And interestingly, medications that are prescribed for depression, two of them I'm thinking of, Cymbalta, which is duloxetine, and Effexor, which is venlafaxine. They are prescribed for depression and anxiety, but they also can help with physical pain. So again, the distinction may be artificial between physical and emotional, in that, for example, the Cymbalta can help with both emotional pain and physical pain. Now, in treating people with emotional trauma, we want to be careful. That just crossed my mind because a patient told me that when she started talking about abuse, sexual, physical, emotional abuse in childhood, she attempted suicide. So we want to be very careful in treating these patients with psychotherapy, because that can be like opening up a can of worms and can cause a lot of distress and potentially suicide. On the other hand, not talking about these issues, not thinking about them, kind of pushing them away emotionally, mentally, can create a pressure cooker feeling And that also can be quite distressing, of course. So it's a balance, and we want to have the patient be in control of whether or not they want to talk about a given traumatic issue or a psychologically distressing issue at a given time. So if a patient's not ready, we want to leave it alone and not open up a can of worms that they may not be ready to cope with emotionally. And as doctors, we want to keep an open mind. Let's say if we're working in an emergency room and someone comes in with physical issues, or if we're working on a hospital ward as an internist or as an internist in a clinic, we want to keep an open mind. And if someone comes in purely complaining of physical issues, we want to consider, is there an emotional aspect? Is there something we need to address emotionally? And that can be tricky because often we're very busy and we don't want to do additional work because we have the next patient waiting. And I remember myself as an intern, I remember a lady came into the emergency room who'd been raped, as far as I recall, and beaten up. And I did not even think to call a psychiatry consult at the time. So in hindsight, I look at that and think, wow, that is really not looking at the whole picture and not really giving the patient the best help. Thank you.